In the year 460 BC, Hippocrates, the father of medicine, discovered an odd-looking lump in one of his patients. He would then conclude that this was a malignant tumor, and then he would go on to name it cancer. But little did he know that 3,000 years later, cancer would still be one of the diseases with no definite cure.
Well, you had chronic viruses at least.
Well, that's right, but the search for the cure is still underway, and pediatric oncologists play a very large role in that.
Oh, my name is Midalove, Antoine.
And I'm Mia Hernandez.
And we are here today to present research on pediatric oncology that we came from the databases. So you asked why we chose pediatric oncology. As high school juniors, we don't have much knowledge on the medical field, and the knowledge that we do know comes from our medical laboratory class. And we felt that pediatric oncology is within the scope of our knowledge, and besides, who doesn't want a shot at curing cancer?
So who are pediatric oncologists and what do they do? Pediatric oncologists diagnose, care for, and treat children with cancer. Pediatric oncologists will typically treat cancer and blood disorders more with medication and chemotherapy than with surgery and radiation therapy. While a pediatric oncologist has many responsibilities as examining patients, ordering diagnostic tests, analyzing test results, making diagnosis, and coordinating with other doctors to treat or manage side effects. They do use various methods of treatment such as chemotherapy, immunotherapy, stem cell transplant, radiation therapy. So in order to fill out all these jobs, they have to go through an extensive education process. Pediatric oncologists must complete 4 years of undergraduate studies in a pre-med track and do 4 years of medical school, in which the last 2 years are spent in clinical rotations where they choose a specialty, then do a 2 to 3 year residency program, and then they can specialize in pediatric oncology and follow through with the fellowship program.
After taking out a loan for almost $400K to go to medical school, pediatric oncology finally became attending to have a chance to pay it off. On a global scale, a pediatric oncologist get paid anywhere from $23K to $400K depending on their socio-economic status of their country. Coming from a more local in the United States, pediatric oncologists get paid anywhere from $59K to $324K annually in Florida. Pediatric oncologists get paid anywhere from $49K to $273K annually. Becoming a pediatric oncologist have many advantages as well as some are helping children. Many people chose to enter the medical profession to help others. Treating kids impacted by illnesses, accidents, or other diagnoses can be very satisfying, as well as positive influencing the youth. Not all periodic specializations require dealing with a critical ill kid. Some inspirational patients' kids can smile and laugh through all sorts of difficulties and can bounce back from hard times faster than many adults.
Despite the financial benefits, pediatric oncologists are being challenged on a daily basis. They are watching kids suffer while empathetic doctors will have a hard time seeing any kind of patient suffering. Seeing kids in pain or dying can take an emotional toll. Communication is very important. Some kids can't always express their needs and feelings. You must have an excellent understanding of medicine and pediatric illness to diagnose children accurately. And also dealing with parents, interacting with parents can be very difficult since some will understandably be stressed and upset.
Transition into the workplace of pediatric oncologists. So the nature of pediatric cancer care requires a specialist physician largely practiced in the hospital settings because of the type of the treatments their patient requires. Being in this type of workplace helps them with the access to the equipment they will need, especially when it comes to MRI and CT scans, and taking blood tests to be able to help research to cancer and confirm a diagnosis.
One of the interesting things that we did add to the board were that pediatric oncologists would like others to know, and they would want others to know that it is hard and uncomfortable to see children in cancer therapy, that cancer is not rare, and that curing cancer and preventing cancer is not the same thing. And one of the reasons we did decide to add this on our board because sometimes it's hard to see from a doctor's perspective and think that they don't know the gravity of the situation. At the end of the day, we all know what we're doing and what we can to make the child feel comfortable and safe. As sad as it is, cancer does not have a cure around the corner, and even if we did, we still need a pediatric oncologist to administrate it.
As far as we're concerned, Hippocrates will have to wait long before the cure for cancer given the amount of research in our generation.
Thank you.